Hi there. Friends, ever noticed your skin getting itchier as you age? If you're over 60, that itch might be more than just dry skin. Sometimes, it's your body's way of waving a red flag about a health issue. In this video, we'll explore 4 signs that mean it's time to see a doctor about that itching. Picture this: an itch that won't quit. Keeps you up at night, spreads all over, or comes with worrying symptoms like weight loss or fever. These are clues you shouldn't ignore. Let's dive in to learn when itching needs medical attention. Stay tuned and take charge of your health. Persistent itching. What exactly is persistent itching? It's when the itch lasts for more than 2 weeks and doesn't get better with over-the-counter creams or lotions. Research shows that about 21% of people over 60 deal with this, and the number jumps to over 50% for those over 80. That's a lot of people scratching. As we age, our skin loses moisture and oils. This leads to dry skin, or xerosis, which is the most common culprit. But sometimes, the cause is deeper, and that's where worry creeps in. Persistent itching can stem from various sources. Skin conditions like eczema, psoriasis, or contact dermatitis can make your skin end itchy. More concerning, it might signal internal issues. For example, over 50% of people with chronic kidney disease experience itching, according to medical studies. Liver problems, thyroid disorders, or even certain cancers can also show up as persistent itching. Some medications, like those for blood pressure, can trigger it too. It's like your body's sending a signal, and you don't want to ignore it. If your itching lasts more than 2 weeks, disrupts your sleep or daily routine, covers your whole body, or comes with symptoms like weight loss, fatigue, or fever, it's time to see a doctor. Don't wait. A doctor can run tests to find the cause, whether it's a skin issue or something internal. Early diagnosis can make a huge difference, offering treatments that ease the itch and address the root problem. While you're waiting for your appointment, there are things you can try. Keep your skin hydrated with fragrance-free moisturizers. Think of it as giving your skin a big drink of water. Skip hot showers, which can dry out your skin even more. And use gentle, unscented soaps. These steps might help, but if the itching sticks around, don't delay that doctor's visit. Here's the hopeful part. Many causes of persistent itching are treatable. Whether it's a skin condition, a thyroid issue like Johnson's, or something else, doctors have tools to help. Research from sources like the National Institutes of Health shows that treatments, from topical creams to medications, can bring relief. Imagine getting back to your favorite activities without that constant urge to scratch. So, what's the next step? If you or someone you care about is dealing with persistent itching, don't brush it off. Make that call to your healthcare provider. Share your symptoms, get checked out, and take charge of your health. You deserve to feel comfortable in your own skin. Let's make that happen, together. Whole body itching. Picture this. You're 7 like Thompson, a cheerful grandpa who loves tending his garden and playing with his grandkids. But lately, he's been battling an itch that's everywhere: arms, legs, back, you name it. It's not just a little tickle. It's like his whole body is screaming to be scratched. He tried lotions, thinking it's just dry skin, but the itching kept him up at night, leaving him tired and frustrated. Sound familiar? Today, we're diving into whole body itching in older adults, why it's a big deal, and how you can find relief. So, what's whole body itching? It's when the itch spreads across large areas or your entire body, not just one spot. Doctors call it generalized pruritus, and in older adults, it can be more than just a nuisance. While dry skin is common, whole body itching can signal something serious. Research shows it might be linked to skin conditions like scabies, where tiny mites cause intense itching, often in nursing homes. But it's not just skin issues. Internal problems can be the cause. For example, up to 6% of people with end-stage kidney disease on hemodialysis experience whole-body itching, according to studies. Liver issues, like bile salt buildup, can make your skin itch all over, especially on palms and soles. Blood disorders, like polycythemia vera, can trigger itching after a warm bath, affecting up to 36% of patients. Even cancers, like lymphoma, or diabetes-related nerve damage can show up as widespread itching. It's a bit scary to think about, and it's okay to feel concerned. It means you're listening to your body. When should you act? If your itching lasts more than 2 weeks, feels intense enough to disrupt your life or sleep, or comes with symptoms like weight loss, fatigue, or fever, don't wait, see a doctor. They might order blood tests, a skin exam, or other checks to find the cause. Early diagnosis can make a huge difference, catching issues like kidney or liver disease before they worsen. While waiting for your appointment, try fragrance-free moisturizers to soothe your skin. Avoid hot showers, which can dry it out more. But don't rely on home remedies alone. Persistent whole-body itching needs professional care. Here's the hopeful part. Many causes are treatable. For Des Thompson, treating his kidney disease not only helped his health, but also stopped the itching. Whether it's a skin condition, a systemic issue, or a medication side effect, doctors have options like creams, pills, or even light therapy to help. Research shows treatments can significantly reduce itching, giving you back your comfort. Itching with other symptoms. Itching with other symptoms, like weight loss, fatigue, fever, or night sweats, is a big deal, especially for folks over 60. It's not just dry skin or a random itch, it's your body sounding an alarm. Research shows that 10 to 50% of chronic itching cases in older adults are linked to systemic issues, not just skin problems. That's a wake-up call, and it's okay to feel a bit worried. It means you're paying attention. Let's dive into Mrs. Carter's story. She noticed the itching a few months ago, mostly at night, and it was relentless. Then came the weight loss, tiredness, and those night sweats that soaked her pajamas. She tried lotions, thinking it was menopause or stress, but nothing helped. Her daughter urged her to see a doctor, and tests showed a condition called lymphoma, a treatable cancer. With therapy, Mrs. Carter's symptoms improved, and she's now planning her next baking day. Her story shows why we can't ignore these signs. So, what causes itching with other symptoms? It could be diabetes, which affects over 25% of older adults and can cause nerve-related itching. Thyroid disorders, like an overactive or underactive thyroid, can trigger itching along with fatigue or weight changes. Blood disorders, like Mrs. Carter's lymphoma or polycythemia vera, often pair itching with night sweats or fever. Even infections, like hepatitis, can cause itching with fever. Studies from the Journal of the American Academy of Dermatology highlight that these symptoms together need urgent attention, as they might point to serious conditions. When should you act? If your itching lasts more than 2 weeks, feels intense, or comes with weight loss, fatigue, fever, or night sweats, don't wait, call your doctor. They might order blood tests, imaging, or a skin exam to find the cause. Acting fast can catch issues early, when they're often easier to treat. While waiting for your appointment, try gentle, fragrance-free moisturizers and avoid hot showers, which can worsen itching. But don't stop there. Professional care is key. The good news: many causes are treatable. For diabetes, managing blood sugar can reduce itching. Thyroid medications can help balance hormones. Even for cancers like lymphoma, treatments like chemotherapy or immunotherapy can bring relief. Studies show early diagnosis improves outcomes, giving you hope for better days. Severe itching. Severe itching, or pruritus, isn't just a little annoyance. It's a relentless, burning sensation that can make every day a struggle. For older adults, it's more than dry skin. It might be a sign of something serious. Research shows it can disrupt sleep, lower mood, and even lead to skin infections from constant scratching. That's why we need to pay attention. And I'm here to walk you through what severe itching means, why it happens, and how you can find relief. Let's start with what makes itching severe. It's not just a tickle you can ignore. It's intense, often persistent for weeks, and can keep you up at night or distract you from daily tasks. Studies, like one from the National Institutes of Health, suggest that severe itching can significantly reduce quality of life, especially in folks over 60. It's tough to hear, and it's okay to feel worried. It shows you care about your health or someone else's. Now, let's talk about why this happens. Severe itching in older adults can come from several sources. First, skin conditions like eczema or psoriasis can cause red, itchy patches that feel unbearable. Then, there are systemic diseases. For example, kidney disease can lead to waste buildup in the blood, triggering itching. Medical studies report that up to 66% of people on hemodialysis for kidney failure experience severe itching. Liver diseases, like cholestasis, can cause bile salts to build up under the skin, making you itch like crazy. Neurological issues, such as nerve damage from diabetes or shingles, can also spark intense itching. Some medications, like blood pressure drugs or opioids, might be to blame. And in rare cases, severe itching could signal cancers like lymphoma. That's a lot to take in, but knowing the causes helps us act. When you visit your doctor, they'll likely ask about your symptoms, check your skin, and maybe order tests like blood work or a skin biopsy to find the cause. It might feel overwhelming, but this step is crucial. The good news: many causes of severe itching are treatable. For skin conditions, doctors might prescribe creams or pills to calm the itch. If it's a systemic issue like kidney or thyroid problems, treating the underlying condition often helps. For example, studies show that medications like antihistamines or even phototherapy can ease itching in many cases. So, what can you do right now? While waiting for your doctor's visit, try gentle, fragrance-free moisturizers to soothe your skin. Avoid hot showers, they can make things worse. But most importantly, don't ignore severe itching. It's not just part of aging. Taking action can lead to answers and relief. Research tells us that early diagnosis improves outcomes, so pick up the phone and make that appointment. Let's wrap up with a spark of hope. Severe itching can feel like it's stealing your joy, but you don't have to live with it. With the right care, you can get back to feeling like yourself, whether that's knitting, gardening, or just enjoying a good night's sleep. If you or someone you love is struggling with severe itching, reach out to a healthcare provider today. You deserve to feel comfortable in your own skin, and help is just a step away. Hey friends, let's wrap up. Itching after 60 isn't always just dry skin. If it's persistent, severe, all over, or paired with things like weight loss or fever, it's a sign to act. Those 4 signs lasting weeks, disrupting life, covering your body, or tied to other symptoms mean it's time to call your doctor. Don't wait. Early action can bring comfort and peace of mind. You deserve to feel great. So pick up that phone and make the appointment. Here's to healthier, itch-free days ahead.